If you're over 60 and dealing with joint pain, you've probably heard the same explanation again and again. It's arthritis. That's just part of aging. But what if that answer isn't the full truth? What if the pain in your knees, hips, or shoulders isn't simply because of wear and tear? What if doctors, whether by habit or by system, have been missing something important? Let's be clear. Arthritis is real. Osteoarthritis is common in older adults, but here's the uncomfortable truth. Not all joint pain in seniors is due to arthritis. In fact, some of the most persistent joint problems come from completely different causes. And when those are ignored, no amount of painkillers, anti-inflammatories, or joint supplements will bring relief. Here's what often happens. A senior walks into a clinic complaining of knee pain. The doctor asks a few questions, maybe takes an x-ray. The report says mild degeneration, or joint space narrowing. And just like that, the patient is labeled arthritis. Case closed. They're told to manage it with NSAIDs, glucosamine, and low-impact exercise. But the story isn't always so simple. Joint pain in older adults can stem from many overlooked sources: muscle imbalance, nerve entrapment, vascular insufficiency, old injuries, or even poor biomechanics. None of these will show up clearly on a standard X-ray, and none of them are treated effectively with arthritis medications. Take muscle imbalance, for example. As we age, many of us lose muscle mass, especially the deep, stabilizing muscles that support the joints. When these muscles weaken, other tissues pick up the slack. Tendons get irritated, ligaments get strained, and the joint starts moving in ways it wasn't designed to. The result? Pain that feels like arthritis, but isn't. Or consider the nerves. If you have numbness, tingling, or shooting pain along with your joint discomfort, it might not be the joint at all. It might be a pinched nerve in the spine or pelvis. That kind of pain can mimic arthritis almost perfectly, but the treatment is entirely different. And here's the kicker. Many doctors don't have the time or training to dig deeper. The system rewards quick answers. Arthritis becomes the default diagnosis for anyone over 60 with joint complaints. It's easy, it's expected, but it's not always accurate. In this video, we're going to expose the most common misdiagnoses surrounding joint pain in seniors. We'll explore what signs to look for, what tests to request, and what alternative causes you should consider if your current treatment plan isn't working. Because sometimes the real problem isn't your joint. It's what's around it, or what supports it, or what's missing entirely. And once you understand that, you can finally start healing. By now, it's clear that joint pain in seniors is far more complex than the typical arthritis explanation suggests. In fact, the most frustrating cases often involve multiple hidden factors working together. And when you treat only one piece of the puzzle, like inflammation inside the joint, you risk missing the larger picture. That's why so many older adults find themselves stuck, bouncing from one remedy to another with little or no relief. Let's dig deeper into one of the most common and ignored contributors to chronic joint pain: posture and movement patterns. Over decades of living, our bodies adapt to the habits we build. Sitting for long hours, carrying heavy loads unevenly, favoring one side due to an old injury, these can all lead to dysfunctional movement. The result is something called joint overload. One part of your body ends up doing more work than it should, while another part gets weaker or tighter. Eventually, that imbalance causes strain and pain. Take the knees, for example. Many seniors complain about knee stiffness and assume it's due to arthritis. But if the glutes are weak and the hips are tight, the knees will compensate during walking or standing. Over time, this poor movement pattern creates joint stress and inflammation. Even if the cartilage itself is mostly intact, no supplement or medication will fix a weak muscle. The only solution is to restore balance through targeted exercises. Now consider how many seniors are given pain medications without ever being taught how to move differently. Painkillers may offer short-term relief, but they don't teach you to walk better, squat safely, or stand with proper alignment. If your everyday habits continue to strain the joint, the pain will always come back. Let's also talk about breathing. It may seem unrelated, but proper breathing affects your entire posture. Shallow chest breathing tightens the upper body and weakens the diaphragm, which indirectly affects the lower back and pelvis. Over time, This can pull the spine out of alignment and increase pressure on the hips and knees. Yes, something as simple as poor breathing can lead to joint pain. The truth is, many seniors are given surface-level answers because deeper assessments take time. Most healthcare systems are built for speed, not depth. But to truly fix chronic joint pain, you need someone who looks beyond the joint itself. Someone who asks questions about how you move, how you sit, what muscles are firing, and which ones aren't. So what can you do starting today? Begin by observing how you move throughout the day. Are your shoulders rounded forward? Do you feel more weight on one leg than the other when you stand? Does your back tighten when you get out of a chair? These small clues can reveal bigger imbalances that lead to joint stress. Keep a journal if you need to. Every detail matters, because the better you understand your body's patterns, the closer you'll be to breaking the cycle of pain. When joint pain doesn't respond to the usual arthritis treatments, it's often because the root cause has been misidentified or never investigated at all. And here's where many seniors get caught in a frustrating loop. They're told to take anti-inflammatory drugs, maybe do a bit of stretching or swimming, but the deeper structural issues remain untouched. The result? Temporary relief followed by more stiffness, more soreness, and a creeping sense that this is just how aging feels. But it doesn't have to be that way. Let's talk about your feet. Yes, your feet, the foundation of your entire body. If your arches have collapsed or you favor one side due to an old ankle injury, that imbalance travels upward. It shifts your knees, your hips, your spine. Suddenly, your back aches and your knees hurt when climbing stairs, not because of arthritis, but because your body is compensating for poor foot mechanics. Something as small as a worn-out insole or a poor-fitting shoe can throw your entire joint system out of balance. Next, let's consider hydration. Joint tissues rely heavily on water to stay flexible and resilient. As we age, our sense of thirst declines, and many older adults live in a state of low-grade dehydration without realizing it. This doesn't just affect energy and digestion, it affects the joints too. Dehydrated cartilage becomes brittle. The space between bones shrinks. Ligaments lose their elasticity. If your water intake is too low, no supplement will make your joints glide smoothly. We also need to address nutrition, not just general healthy eating, but very specific nutrients that support joint and nerve function. Many seniors are deficient in magnesium, which is essential for muscle relaxation. Without enough magnesium, muscles remain tight, pulling on joints and causing unnecessary stress. The same goes for omega-3 fats, which help reduce inflammation, and B vitamins, which are crucial for nerve health. A standard multivitamin won't always fill these gaps, especially if digestion is impaired, which is common with age. Finally, there's stress. It may sound surprising, but emotional stress has a very real impact on physical pain. When the body is under chronic stress, it produces higher levels of cortisol, which increases inflammation throughout the body. It also causes muscles to tense up, breathing to become shallow, and blood flow to decrease, all of which make joint pain worse. Managing stress isn't just about feeling calmer. It's about giving your joints a chance to recover. So the next time someone tells you it's just arthritis, take a step back. Ask yourself, am I drinking enough water? Are my shoes supporting me properly? Is stress showing up in my body? You deserve more than a one-size-fits-all answer. Your joints are part of a much larger system, and understanding that system might be the first real step toward freedom from pain. By this point, you've likely started to see just how many hidden factors can influence joint pain. It's not always about what's happening inside the joint, but what's happening around it, or even far from it. And yet, so many treatment plans focus only on managing symptoms rather than solving the actual problem. That's why it's time we talk about one of the most overlooked tools in restoring joint health: movement. Now, when many people hear movement, they think of exercise. But not all movement is created equal. For seniors with joint pain, especially those misdiagnosed with arthritis, the right kind of movement can be more effective than any medication. But the wrong kind of movement can make things worse. Gentle, intentional movement, done regularly and consistently, has the power to retrain your muscles, realign your joints, and restore healthy patterns. Think of it like reminding your body how to work properly again. This is where modalities like physical therapy, Tai Chi, or corrective stretching routines become valuable, not because they're trendy, but because they help restore coordination between muscles and joints. Let's say you have chronic hip pain. You've tried joint creams, painkillers, and maybe even injections, but nothing helped. The real issue might be that the muscles supporting your pelvis have forgotten how to engage properly. A targeted movement routine that activates your glutes, improves spinal alignment, and loosens tight hip flexors could create more change than months of pills ever could. Another reason movement is essential is circulation. Motion boosts blood flow, which carries oxygen and nutrients into your joints and removes waste products. Without it, tissues become stiff and inflamed. That stiffness you feel in the morning? It's not just aging. It's the result of poor circulation and muscle inactivity. And the fix isn't more rest. It's better movement. But here's the catch. Many seniors are afraid to move. They've been told to take it easy or avoid anything that causes discomfort. This fear, though understandable, often leads to more immobility and more pain. What's needed isn't less movement, but smarter movement. The key is to start with small, safe, controlled motions and build from there. Working with a knowledgeable movement specialist can make a world of difference. It's not about lifting weights or running marathons. It's about teaching your body to support itself again, step by step. So don't be afraid to start small. Even a 5-minute walk, gentle ankle rolls, or light stretches in the morning can begin to shift the way your joints feel. Over time, those small changes add up. Because when you move with intention, you're not just relieving pain, you're rebuilding your body's ability to support itself. And that's something no pill can do. Movement isn't just therapy, it's information. It tells your brain that your body is still capable, still adaptable, still alive. And when your brain believes that, healing becomes possible. That's the deeper truth missing from most joint pain advice. After everything we've explored, misdiagnosed causes, overlooked muscles, nerve issues, hydration, nutrition, stress, and smart movement, it's time to address the bigger truth behind joint pain in seniors. It's not just a physical issue. It's often a message from your body asking for attention, adjustment, and care that goes beyond pills and standard protocols. Let's be honest, many seniors have been taught to live with pain. It becomes part of the background noise of daily life. You wake up and the knees hurt. You walk to the kitchen and the hips feel stiff. You try to garden and your back gives a warning. Eventually, it becomes easier to stop trying. The pain defines the limits of your day, but it doesn't have to stay that way. The human body, even in later years, is capable of remarkable adaptation. Muscles can be rebuilt, nerves can be retrained, circulation can improve, balance can return, but none of that happens by chance. It happens when we stop treating pain as a permanent sentence and start treating it as a clue. One of the most empowering shifts is learning to become your own health detective. Start asking better questions. Where does the pain really come from? When does it show up? What makes it better or worse? Keep track of your hydration, your posture, your movement, your stress levels. These may seem like small things, but together they build the roadmap to recovery. And don't be afraid to challenge a diagnosis that doesn't make sense. If someone tells you it's arthritis, but your pain comes and goes, or moves from joint to joint, or gets worse with stress or fatigue, there's a good chance it's something more complex. Don't settle for vague answers. Ask for more specific assessments. Seek out practitioners who understand the whole body, not just the joint. Also, surround yourself with people who believe healing is possible. Too many seniors are surrounded by voices that say, "That's just aging," or "What do you expect at your age?" But pain isn't a requirement of getting older. In many cases, it's a result of habits, imbalances, or conditions that can be changed, if someone takes the time to look. And finally, be patient with yourself. Healing is not linear. Some days will feel better than others. But if you continue to support your body with good movement, thoughtful nutrition, hydration, rest, and emotional care, you'll begin to feel the difference. Not overnight, but over time. Your joints are not just hinges or worn-out parts. They're part of a living, responsive system. And when you give your body the right signals, it listens. So don't let a label like arthritis define your future. You are still capable of change, still capable of healing, and still capable of feeling strong again, one step at a time.